Good morning. Are you hungry? Are you hungry for food? Are you hungry for food as medicine? So that's what we're gonna talk about right now. Let's talk about food as medicine.
I want to welcome our next guest, Dr. Shad Marvasti.
Dr. Shad Marvasti joins me now.
We spoke with Dr. Shad Marvasti.
Joining us now is Dr. Shad Marvasti, a practicing physician trained in primary care, public health, and integrative medicine.
Joining us is our health insider, Dr. Shad Marvasti. Good to see you again.
It's a new era with these GLP-1s, and I think that there's many different implications for a lot of the chronic diseases of our time, as you mentioned, cardiovascular disease, cancer, diabetes, obesity. So they really do provide a relief for the 34% of Americans who are obese, the 11% of Americans who are diabetic, and cardiovascular disease is the number one killer. So I think it is a game changer in terms of what these provide, but I also would just add the cautionary note that we need to concomitantly prescribe food and lifestyle prescriptions alongside these medications. If you have underlying risk factors and you have an underlying narrowing of your arteries that feed your heart, then basically when you strain it, right, from excess heat or excess cold, that's going to cause your body to do more to compensate for that extreme temperature. How we feel, how we think, our mental well-being, if it's challenged in any way, and it's persistently challenged over time, leads to chronic inflammation, increased blood pressure, increased stress hormones like cortisol, all of these things which contribute to increased risk of real physical diseases like heart disease, which is the number one killer.
Chronic diseases are the leading cause of premature preventable death and disease in the entire world. In the United States, we have the dubious distinction of leading the world in chronic disease, where 6 out of every 10 Americans has one of these chronic conditions. These conditions account for 7 out of every 10 deaths and over 90% of the $4.3 trillion we spend on healthcare every year.
Our food is like a messenger signal that goes in and tells us what genes to turn on and what genes to turn off. So actually, from the inside out, you are what you eat. What we eat actually changes us at the genetic level. We can turn on pro-cancer genes or we can turn them off. We can turn on pro-heart disease genes or we can turn them off.
As a practicing physician, I advocate for the use of food as medicine. I teach my patients how to buy and prepare healthy meals. And as a medical educator and professor at medical schools, I work on redesigning our medical education system to include nutrition and food as medicine because it's critical.